Okay, look, everybody, look. We've got Janet Smith now. Janet is the head of sustainability at the fantastic Royal Wolverhampton NHS Trust and Walsall Healthcare NHS Trust, who combined are, of course, our regional hub for the West Midlands. Janet is going to tell us really about Royal Wolverhampton and Walsall Healthcare's journey to environmental sustainability. And without further ado, I'm going to hand straight on to Janet. Janet, you've got some slides, I know. Here you go. Over to you. Thank you.
Hi, I'm Janet Smith. I'm Head of Sustainability for Royal Wolverhampton and Walsall Healthcare NHS Trust. What I'm going to share with you today is basically our experience in greening our services and trying to achieve the mandated net zero carbon by 2040 for direct emissions and 2045 for NHS carbon footprint plus. So I'm going to focus today actually on the Royal Wolverhampton because for the reason that it's a bit ahead in terms of its implementation of its green plan compared to Walsall. So Royal Wolverhampton has put together its green plan and was signed off by the Trust Board on March 2021. And basically the areas of focus of it is making sure that there is an effective leadership and governance around sustainability. There's also a good monitoring and reporting of outcomes. Looking at carbon emissions, reducing the carbon emissions of our services, and also looking at our buildings and estate, looking at focusing on energy and water consumption, prevention and management of waste, sustainable care models, sustainable procurement of goods and services, promotion of sustainable business, patient, visitor, and staff commuting, and also engaging with key internal, external partners and stakeholders. So this green plan actually is over 5 years, and what we've looked at is targeting a 25% reduction from the baseline by 2025. So that would be, and we're hoping to reach net zero by 2040, as I said earlier, and also net zero on NHS carbon footprint plus in 2045. Next slide, please, Jade. Thank you. So where we are currently in terms of implementing the green plan. One, we have what we call greening hospital services. So we have individual early adopters, we call it early adopters. So these are individual services that have signed up to green, to look at their services and find ways and means within its processes to actually reduce its carbon footprint, whether it is in the procurement side, energy, waste, and also reducing care miles. So currently we have the orthotics department, endoscopy, the theaters, the greening theater services, prosthetics service, urology, therapies, oncology, rheumatology, so all other services. So we have about 11 currently that's doing that. So as of this time, due to the pandemic and at the same time the will of the trust to actually continue implementing services, outpatient services, and also continue giving quality service to our patients. We have been doing virtual clinics, and in fact we are expanding it. And by implementing virtual clinics, we've managed to actually save 1,864,673 patient travel miles, which is equivalent to 4 round return trips to the moon, and which also basically saved 343.7 tons of CO2. And this, when you look at our carbon footprint, the trust carbon footprint, travel and transport carbon footprint, actually stands at 389 tons. So by implementing virtual clinics, we basically are within, it's only 46 tons more what we need to reduce to actually zero out that area. Second is that we've also saved 168,502 kilos of CO2 by switching to recycled paper. And then we also managed to actually reduce our use of volatile anesthetic, particularly on desflurane, which has the highest greenhouse effect, to 3.1. When we started this journey, our use of desflurane was actually at 13.9. So by February, we managed to reduce it to 3.1. One of the areas that we looked at as well was our estate strategy. And if you notice, our estate strategy actually is aligned with our green plan. So it's also a 5-year plan. And the intention actually is to deliver and operate an estate that is safe, sustainable, and fit for purpose to meet the changing needs of the patient. And this includes adaptation to mitigate the effect of climate change. So at the moment, we are actually in the process of implementing ambitious estates carbon reduction schemes, so decarbonizing our estates. One of them is we are currently building our solar farm across the way, utilizing a brownfield that can't be used for anything else because it's contaminated. And it's the size of it is equivalent to 21 football pitches. And it will provide us with 79% of our energy requirement at the current level. So this will actually help us reduce the cost of our energy. And as we know, everyone knows the energy cost has just gone, sky high, and is becoming really unaffordable. The other thing as well is we are installing and replacing the current lighting system to LED. So part of our reactive maintenance and also preventative maintenance regime is whenever there is whenever we change something goes off, we change that system to LED. But at the same time, the trust has actually managed to acquire, funded wind funding from the SALIX funding for decarbonizing estates. We managed to win 33 million funding from SALIX, and that will actually fund some of the installation of heat pumps, a new incinerator, and also a more wide installation of LEDs. We also have signed to the plastic pledge, and the trust has committed to actually reducing single-use plastic. And I'm proud with the team actually to share with you that the trust has managed to reduce, particularly on the catering side of things, managed to reduce all single-use plastic and replace it with an alternative product, except for things that are, there's no alternative. One of them is actually the you know, the drinks cups, the lid, there's no alternative. So unfortunately, we still have plastic lids. Next slide, please, Jane. So we also look at sustainable procurement, and this is led by our procurement team. And in fact, on Monday, I'm going to, together with a IHSCM colleague, we're going to actually do a presentation on what sustainable procurement means to our procurement colleagues. So combined procurement colleagues within the both IHSCM and Walsall and Wolverhampton, so that everyone actually has a common understanding of what we mean about sustainable procurement. So we are actively seeking alternative products for single-use plastic. Also working our early adopters are working with their suppliers to actually remove single-use plastic within the packaging of products that they order. And we are also donating orthotics devices like AFOs to charity that reuse them in the developing world, together with Walking Aids as well. We have our pre-cycle scheme, which has saved the trust nearly 26K last year. So it's basically reuse of equipment, medical devices, and furniture that has saved the trust last year 25K, and at the same time reduced a carbon footprint of 7.1 tons. We have of course, the discounted travel card, cycle to work scheme, and car salary sacrifice scheme. The car salary sacrifice scheme, our provider only offers our staff ultra low emissions vehicle and electric vehicle, so nothing else. We've got waste management, so we have expanded the mixed recycling and reducing waste to landfill. Our community sites don't send any more waste to landfill, and our biggest hospital sites are actually has reduced the amount of waste going to landfill. It's very, very low now. Also, we are actively collaborating with stakeholders, internal and external, and local, regional, and national partners. So in terms of how we actually, I think there was some question about carbon footprinting earlier. The trust has actually commissioned carbon footprinting. We had undergone a carbon footprinting exercise that gives us actually what the carbon footprint of the trust from scope 1 all the way to scope 3, including, like, you know, when you transfer dead people to the coroners, that's included. And we have established that, and it's staggering. It actually confirmed that about 60% of our carbon footprint is on procurement. Next slide, please, Jay. So what's the strength of what are the strengths of the RWT sustainability journey? Is that, one, we have a board approved green plan. We have existing leadership and governance structure that is actually overseeing the implementation of the managing and overseeing the implementation of the green plan. There is a strong support from the trust executive. Our capital program actually has a specific budget intended to support sustainable schemes or projects that would require capital input. So that there is that line within the capital program. There is also a core group of trust officers with experience in implementing a successful carbon management plan. And we have quite an extensive carbon champions as well in the team, and they are very, very active. Next slide, please, Jade. What are the challenges that we have actually experienced? For one, winning hearts and minds is gaining the support of the trust staff, and also basically making sure that every one of the staff knows how can they contribute as an individual to the trust sustainability agenda and the implementation of it, and also that they would feel part of the journey in achieving net zero. So we are currently developing different communication and training and briefing documents that targets specific staff group. So and we were finding that in the few that we have started doing, we're finding that it's actually quite effective. We are looking at, nurturing that culture that understands and values environmental and social resources alongside the cost of sustainable, effective, and resilient healthcare services. So like what I said, we're doing that through communicating the Trust Green Plan on its simplest form. Awareness raising, so we actually have sustainability hour every month. So all staff is actually invited. It's on Teams, and they can come in and they can ask any question that they want. We have themes every time. The last one was actually about recycling. The next one is about clinical. Then we have, of course, carbon champions. We engage using the media, the Sustainability Day. We have awards and rewards, so that where we recognize the staff effort. And then there's mentoring and knowledge exchange. Next slide, please. So it's one of the challenges as well.
Just a couple of minutes left, Janet, now. Janet, just 2 minutes left. Thank you.
Yes, yeah. This is the last one. So anyway, it's actually also what we're doing, establishing the carbon footprint of each service so that it's targeted, the actions is targeted. And we're developing sustainable care pathway as well within we're looking at, of course, the adaptation side of things, making sure that our facilities is resilient, low carbon procurement, and low carbon building and operational state standards. So that's it.
Fantastic. Fantastic. Thank you very much indeed, Janet. Goodness me, that's comprehensive. And I love the donut plan at the end there. I like that. That looks mightily impressive as well. Quickly, we've got a bit of time. I don't mind using a minute or two. Would anybody have any questions they'd like to ask of Janet, I wonder? So Janet, Patricia asks, do you have mandatory sustainability and green training for staff?
We have what we're doing currently is that the sustainability or the green plan is part of the trust induction.
Okay.
So
everybody who joins the trust gets something. What about those existing members of staff?
The existing members is actually being now reached towards, because what we're doing is we're developing different training for the different staff group, because what we found is that if we actually have the same training for clinicians and the domestic staff, it's very different. The same way that the porters have very different look, and the same way that we have one for estates, our own estate staff. is also very different from the clinical ones.
Yeah,
So
I get it.
it's
Fine.
tailoring them. So we do have, which I can share.
Perfect. Thank you very much. And Severine asks, Janet, where are your heat pumps going to be used? What are they replacing?
It's actually replacing, because we have one for new buildings. So we're refurbishing one of our big buildings, full refurbishment, and that will actually use heat pumps. We are also refurbishing wards. So it will exchange basically the current heating system with heat pumps.
Perfect. Thank you very much. Well, that was terrific. And just going back to, if you remember, those of you here at the beginning, we were talking to Darren from the integrated care system for Devon, and we were talking about, how do you replace existing legacy systems? But by the sounds of it, at the Royal Wolverhampton or Walsall, what they're doing is they are completely refurbishing buildings and putting in new heating systems to reflect that. So thank you, Janet. That was absolutely super duper. Please give our best wishes to everybody up in Wolverhampton and Walsall. We're very grateful to you indeed for giving some time today to tell us about what you've been doing up there. Thank you.